Thank you, Deepika, once again for the opportunity to you and Ian and US Tech. My name is Siva Juturi. I am Chief Customer Officer at Automation Edge. We are an AI automation platform serving customers globally across many verticals like banking, insurance, healthcare, primarily. And I'm going to talk about what's all the hype about AI is, right? We've been using AI for our customers, and I want to set the context and kind of have you appreciate that why is overhyped and where we need to fine tune in terms of the value of AI, and the value will come from ROI, and the ROI has to be very well defined, unlike traditional automation solutions that we've used in the past, like RPA. So if you see here, I'm going to use healthcare as a theme for this presentation, so that you will take one use case across AI and then see how it translates to ROI, and all the myths of AI are eliminated. So any AI that's already out there right now, doesn't matter which industry vertical it is, there is always a dream outcome, right? Because AI is so overhyped right now with ChatGPT and other conversational AI solutions in the market. At the push of a button or a click, you will get pretty much anything that you want. So there's a dream outcome from a customer's perspective, that customer has very high expectation, and there is still very perceived likelihood of an achievement from a business user standpoint, from an end user, from a persona that you're selling the AI to. Well, the value is not as easy as dream outcome and the percentage or perceived likelihood of achievement. It has to be quantified by by the delay that it will take to deploy the solution, and also the effort and the sacrifice that has to go into the resources that have to take the AI to the where the dream outcome is. So if you see that, the math is very easy here. So the value is pretty much, or the ROI is pretty much driven through those two denominators that you see. The time delay, is it rapid? Is it overnight? Is it a couple of weeks? Is it months? Is it years? And the time of resources and effort and sacrifice. And sacrifice, effort is very easy to quantify, like resources, FTEs, timeline and infrastructure. But it's the sacrifice that is that the end user has to make on testing it, consuming it, adopting it, and also sacrifice that goes through in terms of ensuring that when AI is consumed, whether it is giving the experience, and if it does not, then definitely we are sacrificing the dream that and the value that end user envisioned. So I just want to give a snapshot of the market. The market is growing significantly. It was $200+ billion just last year, and it's probably close to doubling it this year. And you see that the verticals that has been pretty much adopting this, the first half of the pie here, 50% is healthcare, BFSI, and advertising and media and telecom are kind of adopting it very rapidly. So let me just get into now ROI, right? So we already talked about the effort, and obviously there's dearth of talent that needs to be fulfilled first before you go and deploy and consume the solution. So there's definitely lack of skilled AI talent that can really use the tools that are in the market, like Automation Edge. But the second biggest problem, which is close to 30%, is lack of proven ROI when these pilots are being rolled out for customers. And what I call this as, I've termed it as invisible AI. AI, it may not be very visible when it comes to the solution or the adoption or the KPIs that go and the metrics that go with it. So I want to remove that myth of a proven ROI. So how do we make this invisible AI to a visible AI in terms of ROI? There are other contexts of the challenges of AI, like privacy is a big concern in terms of also the data and PHI compliance in healthcare, HIPAA compliance, where the patient data is being utilized to determine things like patient records being and their diagnostics and the treatments that go against that patient has to be very, very strictly confidential with that provider. And then, of course, how do you explain it to the end user, the personas, and the change management that has to go with it. But I'll focus on ROI. And the ROI has to really be defined or qualified by metrics. And I'll take one example in healthcare or what we call home care, which is hospital at home that we are working with our customers, is digital personal assistants. So these personal assistants are an example of an AI that is rampant right now, where you could provide an assistant through an app, which could be consumed by a persona. A persona is a clinician here, and a clinician could be a registered nurse, could be a doctor, could be somebody who's a therapist, And what are they looking at? They're looking at consuming an AI-based personal assistant with some metrics where they have to, typically without this personal assistant powered by AI, are going to be calling the back office of the provider, the hospital system or a clinic, and asking questions about patient information, documentation, what is the diagnostics information. So there are, let's say an example, a mid-size provider, a clinic or a home care agency, they have 2 dedicated staff just dealing with those questions from the clinicians in the field. What is my next appointment? And what do I need to have prerequisites in terms of my compliance requirements before I go and walk into a conversation with that patient? So that is one measure of ROI, is that this AI agent has to either replace or minimize the use of my back office staff as a provider. Second is, am I improving the experience of the patient, of the clinician, with this digital personal assistant, which at a click of a button or a chat conversation, I'm able to get things like summary of the clinical summary of the patient. That means that we have applied Gen AI against hundreds of pages of patient documentation and presented very nice clinical summary that the clinician or a nurse can go through. So that's one other measure of AI, ROI that you're looking at. And the third, which is the most critical, is, as we know in healthcare, the data sits and is always backlogged, right? And always being requested for. And it's always incremental when it comes to patient care. So this digital personal assistant for a clinician has to give real-time or near real-time information so that this clinician can perform the task against that patient, against the treatment cycle or the episode that you're working on. Yeah. So you see how we have kind of devised an ROI metric which is tied to an AI-based digital personal assistant. So I just wanted to peel the onion on that and how the personas will use AI in terms of metrics. So let's take that a little bit next in terms of what are the different catalysts that you can define these values from a technology standpoint, right? So you see that in AI solution, let's say it's a Gen AI, the use cases, it's a personal assistant, and you see that there's an intent, there is heavy data element with patient records, the technology, that means it has to support, as a personal assistant on an app, which is on either iOS or an Android device. And the experience has to be very good in terms of that ease of use of technology. And then it has to provide that workflow. That means it's not just a simple FAQ that the clinician is working on. It has to literally give him or her the ability to see where the patient was, where the patient is, and where the patient will follow on the treatment cycle. So the entire workflow should be visible in terms of the timeline of the treatment as well as the care cycle. And then, of course, people are very integral part of this workflow. That means you should have not only clinician, but also the back office or the management dashboards and reporting available so that this personal assistant, whatever the activity that's going on against that, is being recorded and then provided metrics. So moving further a little bit, now that we have demystified ROI, now we want to see where this whole AI-based hyperautomation is going in terms of the technology stack. So in a single pane of glass, what we have done at Automation Edge is define different actors that will use or consume AI, and what are the different stack of technical components that are engaged in this. So here you see that there has to be an orchestration platform, that it has to be hosted all in the cloud, so there's no infrastructure uh, burnout by the client. There is a DevOps, there is a end user support, there is RPA, there is ETL to mine data, and also there is different channels. And we just talked about digital assistant. The digital assistant could be an app, or it could be a voice or text enabled AI conversation that you can engage, which could be less intrusive than, or a push based model as opposed to a pull based model, which is an app. And if I just have to show the same stack of hyperautomation, which we use in Automation Edge, you see that we have put all the personas in the left side, and the personas could be across any industry, and clinician is one of them here. And then you see the different channels we're using: text, phone, an app, or call itself. And then we have all these orange components, which are part of the hyperautomation stack. GenAI is part of that. Different RPA, orchestration capability, infrastructure automation, and ability to connect to different systems using connectors, which is iPaaS, ETL, and the UI in general. And then, of course, this AI-based engine has ability to traverse all the systems of the enterprise. That in a healthcare system, it could be an EMR, EHR system, it could be a training system that clinician uses, it could be the certification system, and HR, payroll, and other shared systems. So this is how we have used the platform in Automation Edge. And you see here, we bubbled it up, plugged in AI, and then here we call them as solve flows. In case of healthcare, we are saying care flows, and each of them are workflows that come out of the box, which are AI enabled. Things like referral intake for patient intake. It could be clinician burnout, revenue cycle management, eligibility authorization, and so on and so forth. So this is how we have used those AI cloud for healthcare, and you see that it's been a transformative experience for the personas. That includes management, and that has experience element in it, the transformation of clinician, not spending a lot of hours on documentation, but on patient care. So that's really a huge benefit that clinicians are looking at for our customers, is they're taking a lot of time away from just doing pure play documentation or taking notes. And these are our catalog of care flows that we have launched in the market last year. And you see they traverse, right from engagement to intake to compliance and revenue cycle management, both for personal care, which is non-medical service, to home health and hospice and palliative care.